Hola. Yeah. Daniela, can you tell me? What's going on? Hi, folks. Welcome to the Chad Pierce Show. For those of you who are on TikTok, we're getting everything up and running. Well, hello, folks. Good evening, good evening, good evening to you. And welcome to the Chad Pierce Show. I am glad you could join us. I'm just making sure that, oops, I'm just setting up here. Nope.
Keep watching.
Okay. I don't know what's going on there. Oh, there you go. All right. Anyway, ladies and gentlemen, welcome. Welcome to those of you who are watching on TikTok, those of you who are joining on Facebook and YouTube. Welcome to the Chad Pierce Show. I just want to make sure that I'm live. Oh, yes. There you go. So I want to make sure that I'm live. And all is well. Let me just double check on Facebook because we have a lot to talk about this evening. Yes, so I am live. For those of you who are watching, thank you for joining us on. We have audio everywhere. Thank you for joining us. We have a whole lot to talk about this evening. And our topic this evening is health and wellness. Health and wellness. And we're going to discuss divine healing versus medicine. So we're going to have a different, all different kinds of segments here. I just want to make sure that I am coming through live and clear for those of you who are watching on Facebook. I don't know. I see like, oh, it is okay. Okay. Let me see. All right. So, good evening, folks, and welcome. I also have some guests that are going to be on tonight for this show. Before I get into the show and what we're going to be discussing, I would like to say a few words on behalf of my good friend Leo, who has had both of his legs amputated this past week. I went to visit him today and he is in good spirit. He is in good spirit. I visited him for a few hours this afternoon, and I must say that he is doing great, irrespective of the outcome of from what happened over the last few weeks. He's doing great, and we have to give God thanks for that. It could have been otherwise, and I've a few information about him this evening that I just want to run by everyone. So, many of you know him from downtown Nantucket and know that he's a good person. Um, he was one of those people who was very instrumental in the relief program during the hurricane season in Jamaica, especially in the area, in the parish of Trelawney. He was very, very instrumental. And, this happened And all we can do is pray, because now he has lost both his legs, and it's time for the road to recovery. And so I encourage him this afternoon that he will need all the support he needs. He's going to need support from his friends and family to move forward. And so let us all chip in every way we can in terms of supporting him. There is going to be a fundraiser for him, and the topic of it, the title of it is Road to Recovery, and this is going to be on May 20th, Wednesday, May 20th, and this will be at the Backyard Barbecue. So this month, May the 20th, Wednesday, at the Backyard Barbecue, there will be a fundraiser for him. And it's going to be at the Backyard Barbecue, and the donation that they're asking for is just $40. So we're asking our community to come out in their numbers and support Leo, our good friend, because he needs our support. Also, he has a GoFundMe page up and running, and I will put this on my page. I will make mention of it in and out of the program, so that for those who want to assist, and let us look at it this way. When we had the hurricane, I made mention about people thinking that, you have to have big money to put down for these things. No, that's not how it works. If you do have big money, then fine. But if you have a small amount of money, each one can also put a small amount, and a little is much. A little, and that will help. So we're not asking anyone to come down and put in millions of dollars and stuff. Just bring whatever you have for this worthy cause. The more people you get, it is the better. Okay? So for this worthy cause, please come out and support him. And it is going to be Wednesday at 8 o'clock. Wednesday the 20th at the Backyard Barbecue, and I think everybody in Nantucket knows where the Backyard Barbecue is, downtown Nantucket. So this is for a very worthy cause, and we're going to be talking about health and wellness, and we have so much to talk about. Maybe we cannot cover all of this evening because it's a wide topic. It's vast, it's high, it's low, it's deep. It's a lot. And the problem we're having in today's world is quite a bit as it relates to health and wellness. And I look at it this way. In general, many people don't like to go to the doctor. Men in general, it's very tough for them to go to the doctor. And then we narrow it down from everybody to men, not picking on men tonight, because women are included also, but more men so than women. Then we narrow it down to men it's much harder to get men out to see the doctor. Maybe when it gets to category 4, not category 4, but what do you call it? When it gets to stage 4 or whatever stage that comes after, then they might move. Then it is way too long. Then it moves down to men. Then you narrow it down to Black folks and then Black men. And then we have our lovely Jamaicans. And I'm telling you, from experience, I have many friends. Both who have experienced this, they themselves. I am one of those people who have experienced health risks and have people who I watch over who have health issues. And I have many friends also with the same. I do have friends who are in the medical field. They are from doctors to nurses to caregivers to you name every walk of life in the medical field. I know people from neurologists to eye people to podiatrists to pediatricians to just your local PCP, you name it. Practitioners, you name it. So we have invited some folks to be on tonight who have first and experience with people who are going through this situation. We want to make it twofold tonight. So what we want to do first, we want to have a discussion on healthcare, when people should get healthcare, how they should go about it. And then after we have this discussion and some information, then we talk about healing, what comes next, and who gets the benefit, who gets the credit after somebody gets healing. There are people who are going through a lot. And I also want us to talk about mental health too, because that is very serious within our let me just add these people. As within our society today, we have a lot of people, and I think we kind of bypass mental health. I saw a video on Facebook recently where this woman was about to commit suicide, and the police officers in New York talk her down. If you could, you want to mute your mic, please? Yes. So she was about to commit suicide, and the good police officers of New York City talked her out of it. And that was great. That was absolutely great. I'm sure many of us know people with mental illness. That is very serious in healthcare today. Affording healthcare is another risk because people sometimes don't go out to get diagnosed for serious illnesses because they are unable to pay for it. Not only that they're unable to pay for it, but sometimes they are afraid of what they might hear if they go to get tested for whatever reason. The nurses that I have on tonight that will be talking to us, I sincerely hope all of us will listen in keenly because these are people who see these things every day. These are not people who stand on the sidelines and, pick on men or pick on some women or some kid who decided, I fell from a tree and I don't think I'm feeling badly, so I'm not going to go to the hospital. Or I knocked my head in the bathroom and, I don't feel like I should go to the ER. Simple little things sometimes. We have had experience, and I could get people to come on tonight to talk about not paying keen attention to just simple little things turns out to be something more serious. As I said, I have friends and family with all kinds of ailments. Myself, I can tell you that I have gone through a situation. Had I not seek medical attention the time when I did, I wouldn't be speaking to anybody here right now. I would have been dead. This is very serious. And what we want to do is encourage our men and women, men especially, in and around us, to seek medical attention. Wives, we are imploring you to talk to your husbands to seek medical attention. Get the regular checkup that is needed when it is needed. Do your appointments from your doctor when needed. It is absolutely necessary because you and I see the result of not taking care of our health. It is easy, and do not weigh your health with a price tag. I said to somebody when I was talking to them about, it's going to be $1 million for me to see the doctor to do this. And I said, is $1 million worth your life? I don't think so. So we are going to dive in this evening into what needs to be done, how often you should see the doctor, which doctor should you see, and we have some statistic. And I'm just going to read some information that I gather for this show this evening. If you're watching on TikTok, tap up the screen, share and like. If you're watching on Facebook, welcome to the program. If you're watching on YouTube, welcome to the program. Thank you for joining us. I appreciate you. The question of whether to credit God or a doctor for healing often finds its answer in both and perspective rather than either or. Many people view medical professionals and spiritual faith as complementary forces. The perspective of integrated faith for believers, God is seen as the ultimate source of healing, while doctors are viewed as the instrument he uses. The viewpoint often includes several key principles. Medical knowledge, advanced technology, and the skill of surgeon are seen as gifts from God to humanity. Secondary causes. Theology often describes doctors as secondary causes through which God executes his plan for personal recovery. Bible examples. Scripture mentions Luke as a beloved physician. Colossians 4:14 and records, Jesus acknowledged that those who are sick should seek a physician. Mark 2, verse 17. Differing views on credit, how credit is assigned, often depends on one's personal worldview. Spiritual emphasis. Some argue that since doctors only treat while the body's natural process created by God, do the healing, God deserves primary credit. Medical emphasis. Secular or strictly scientific perspectives argue that credit belongs solely to the human effort, years of medical training, scientific assignments, and direct intervention to save life. This is interesting because all this that I've just read, I can say that every one of us who have had medical episodes have gone through this. We have a heart attack. We start dying. A doctor runs in, does his thing, and we are brought back to life or we are saved. Pretty fair. Who gets the credit? This is an interesting topic. And the reason for this is that many people will say, you know, I have a certain doctor, and let me tell you something. That doctor is next to God. Some people will say, you know what? I am not going to the doctor. I'm going to stay home and I'm going to have my pastor and all my leaders come, and they are going to pray and bring heaven down. And that's the only way I think I am going to get my healing. All right, let's get into it. So we have this evening joining us, Pam James Blois. She's a registered nurse at the Nantucket Cottage Hospital and has worked many different specialties over 20 years in nursing, including cardiac emergency, general medicine, surgical care. More than anything, Pam is a Christian who practices according to God's will. Perfect. I could not come up with a better person this evening to talk to us about that. And secondly, we have Jessica Tremble, BSN RN, a Columbia trained nurse with more than a decade of emergency room experiencing, caring for patients in both New York City and here in Nantucket. Her work has focused on emergency medicine, elder care, patients advocacy, and helping families navigate serious illness with clarity and compassion. Jessica now serves as an ambassador for the Homestead of Nantucket, where she continues her commitment to supporting older adults and community well-being. what better people could we have on the show tonight? I'm going to bring them up in the box and have them introduce themselves. So here, ladies and gentlemen, we have Miss Jessica. Hi, how are you?
Hello, thank you, Chad, for having me. I'm well. How are you?
Pamela. Hi, Miss Pamela.
Good evening, everyone. Chad, thank you so much for having me as well. Hello, Jessica.
Hi, nice to see you.
I'll be off camera for a little bit, but thank you so much. I think I'm really appreciating this topic tonight, and I look forward to our discussion.
Thank you, ladies, for being up here. And as I said, these are people with decades of experience who have worked all areas of the hospital. So they would have firsthand knowledge of seeing somebody come into an emergency room, having somebody admitted to the hospital for care, and having many different heart attacks, cardiac arrests. The list goes on. Babies being born, you name it. These are the people who are the persons to talk to. So I want to ask this question. And this can go for anyone. When should we see a doctor? And this can be either one of you or you can after each other. When should generally people see a doctor?
So people should see a doctor on a regularly scheduled basis. A lot of people see doctors when they're having symptoms or an illness, and of course that's important. But in fact, you should see a doctor on a regularly scheduled basis, just like you would take your car in for regularly scheduled maintenance. We ourselves need scheduled maintenance. So one should see it, and that's something you decide with your doctor, but at least annually. You should be seeing your doctor for preventative care.
And I will just add to that, as you said, Jessica, rightly so. There are times too, based on people's health history, chronic conditions that they have, other risk factors will, as you said, it's kind of a tune-up. So if you know that you're working your car, a car that you've had that has some issues on it, you may need to go a little bit more frequently. But in generally, I would agree, at least annually, and bearing in mind those other things like age, your history, and the risk factors that some people have that others don't.
Here it says, men avoid the doctor for a variety of complex reasons, ranging from cultural conditioning and fear of bad news to practical barriers like time and costs. While women are often socialized from a young age to have regular checkup, such as, gynecological exams, men are more likely to seek episodic care, only visiting a doctor when problem becomes too severe to ignore. Can you expound on that, since you have experience in meeting some of these gentlemen who perhaps don't like to go to the doctor but come in an emergency?
Sure. Pam, I'll jump in, but feel free to interrupt me. Yes, I think, as you said earlier, Chad, most people don't enjoy going to the doctor and do avoid it. It is true that we see that men are less likely to go to the doctor. The CDC says as much as 50% of men are avoiding seeing the doctor. I think that it has a lot to do with teaching that we give men about strength and the thought that going to the doctor for some reason shows a sign of weakness. And so men may avoid the doctor for that reason. The problem is that issues that could be managed easily become bigger issues as a result of avoiding the doctor. So that by the time a doctor is encountered, often you may be further in your disease process. Things may be more severe, and these are things that could have been managed. You said earlier, Chad, something about, would your life be worth $1 million? For somebody who said, oh, it would cost $1 million to go to the doctor. And I think that but I'm not a man, obviously. But I think that culturally, in our society, we have taught men, things land on you. You are responsible. So I think there are men who would say, well, no, even if $1 million takes away from my family and their livelihood, for example, then it's not worth it. But I would argue that it's not just about your own life as the man who's avoiding the doctor because of the potential cost. What about the people who care about you and love you, whose lives are surrounded with yours and who would be broken by the loss of you, especially if it was avoidable? What about your lifelong income if a family depends on you? And so it can become a tricky situation where a decision may be made in order to protect family that ultimately is putting you more at risk and your family at risk for losing you.
Pam,
Yes.
can you tell us how does a wife approach a husband or a woman, her boyfriend, to see a doctor? What word do you have to tell that person how do you approach them to tell them to go see a doctor?
I think that was such an important angle that Jessica brought up, as you mentioned, talking about the loss that families encounter, because of course, as we know, we've been cultured that way. Men are meant to be the providers of the family. They're the leader of the home. So I think a very good approach is that, because men have a way of, they've been taught to tough things out, don't complain about things. But one thing that I do know, or I have experienced, is that most men take pride in the preservation of their families. That is something that gives them, that it's a badge of honor for them. So if conversations are being had where you credit them as being the leader of this home, and if you are missing out of this picture, as Jessica says, what happens to the rest of the family? So wives, spouses, girlfriends, or partners should take that kind of approach. View them as the leader, not only as a physical provider, your spiritual leader, all those roles that they play, and you place that responsibility on them, or acknowledge that responsibility, and how important it is to the family structure. That's the framework that you're going to have to go from to have these discussions with men, because I believe you can get them in any other conversation you're having, like, oh, you should just get a checkup. Just because this is not something that they have been taught, they're not buying into it. I think you do have to frame it that you are the leader, and if you are missing out of this equation, the household suffers. And I think they hear that well. I just wanted to add just a little piece as we talk about men not really, they avoid healthcare or avoid going to the doctor, and some of the things that could be managed or could be prevented when they don't go in for, it's not early intervention. I have seen that so much, especially in my culture, that high blood pressure, hypertension, and diabetes, I will tell you, those are the number two, probably most preventable early intervention. If you get in early, that can be managed and managed well. But how many of our men that are in their 50s, when they're still young, those are still young ages, 50s and 60s, who are ending up with end stage, kidney disease, they're on dialysis, they are those things that if they had intervened early, could have made a big difference. So those conversations needs to start happening just when they are younger, just in their 30s, their 40s, women and children and family. It becomes a whole discussion in the family to make this successful for our men.
Yeah, because you would think that, and I'm going to take it down to our culture as you make mention about that, because then you have those. And you would think, like, 20 years ago, 30 years ago, there was information. Information did not transmit so quickly as it does these days. Like, you sneeze And I can tell you that everybody will hear about it in 2 seconds. So wouldn't you think that with all of this kind of information going around now, social media, people are looking online every day and seeing what's happening, that more, and men use social media. Don't you think that some of this information should be there for them to, read or see what's happened and say, you know what, this is not 20 or 30 or 50 years ago. I should jump on the bandwagon of wanting to take care of my health.
I do, yes, I do think that there should be more information in social media that's informing men and normalizing it. But I think the problem with social media is that it has all of everything. So there may, in fact, be really useful information available on social media about this, but it may not be reaching the individuals it needs to reach. And that has a lot to do with algorithms, right? Social media gives us what we choose to look at. And even myself, a very educated nurse on social media, I may go past something that says, eating grapefruit made me lose 50 pounds. And even though I know scientifically that doesn't make any sense, I'm more likely to click that. It's interesting. And that's then what social media will bring back to me. So.
And what about your children? Do we encourage them? Do we take them to see their doctors? I didn't have any, I may have in notes here, like, statistic on children. When do they go to see their doctors? Do you take your children to the doctors the same way for them to get checked, to get regular checkup or scheduled checkup? Don't you think that is something that men and women should do with their children?
Absolutely. I think that Pam was having a little connection issue, so I'm going to jump in. But Pam, feel free to jump in.
Yes, we lost her. I'll bring her back in as she gets on.
Yeah. What we often see, and I don't have the exact statistics in front of me, I apologize, but what we often see is even when culturally it is not normalized to go and see the doctor for adults, it is usually normalized for children to see the doctor. And so we do see that children are coming in for appointments. The younger they are, the more I think regular those appointments are, and sort of all the way into puberty, and then they may fall off. I have a personal anecdote related to this. I'm not Jamaican. I'm half African-American, half white, Bayesian, actually, on the African-American side. But my mother would not go to the doctor. She didn't trust doctors. But she made sure we went to the doctor, both myself and my brother, all the time for any need and all of our shots and all of that. She, unfortunately, very sadly, suddenly died at 47 years old. Very young. And afterwards, we found out that her whole life, from the day she was born, there's 5 arteries in a section of the heart that feed the heart. She was born with just one. So truly, every day of her life was a gift from God. However, if she had seen the doctor, there was an opportunity, medicine and progress given to us by God that would have kept her alive longer. And I will also tell you that even though I grew up going to the doctor regularly and my mother would not go to the doctor, as I became an adult, it seemed less normal to go to the doctor all the time, because even though I was going as a child, I looked at the adults in my family and they weren't going. So there was a part of me that thought, well, when you get to be an adult, you don't go anymore.
Yeah. Pam, are you back?
Yes, I am.
Okay.
I'm sorry.
Pam, speak to us on if we should think about the costs when it's time to go to see a doctor, whether it's an emergency situation or we know that it's going to cost us. Should we, in our heads, first thing, talk about financial concerns? I'm looking here, lack of insurance, or I perceive high costs, out-of-pocket medical expenses keep many from preventative care. Should that be something we think about before we go to see a doctor?
So I guess the easy answer would be we shouldn't think about it. But the reality of life, the different things that people face every day, um, that is a real people could be in a difficult spot where they do choose between their health and say I'm let me just be technical. You're going to choose between your health and food. We know because we in the long run we all say it sounds so cliche, of course you need to take care of your health because if you're not healthy you can't take care of anybody else, and that is first and foremost. That should always be the objective, that should always be the goal. But the reality of what we see, why sometimes people, and there are these disparities, it really is around money and around cost. The cost of healthcare is really scary for some people. How much that they're going to pay, it does weigh on them and is sometimes a deterrent to why people don't see the doctor. Should it be? We can say no, but sometimes we don't always understand what folks are going through. But what I as we are in healthcare, Jess and I, we see this all the time, where especially in the emergency room, we'll say we're insurance blind. We want to treat you first, and we want to take care of your health first. We don't want you to think about that, and those things will come after. But they have to present themselves for us to be able to help them to access some of those resources, because they do exist. We do know that people have experiences where they have ended up with huge bills. We're on Nantucket. A Boston Med flight is about $20,000+. That is an overwhelming figure. If no matter what you're going through, I think it's very hard for you to be staring down. You don't see the $20,000 bill yet, but you know it's coming. It is on your mind. But this is where clinicians, healthcare nurses, we're going to put you at ease a little bit to say, listen, you don't know if you're going to come back from that flight. So here's what we're going to do. We're not going to worry about that $20,000 flight today.
Mhm.
We're not going to worry about Boston Med flight because anything could happen. We don't know what game is going to be played now. And the worst that can happen is that you end up with a bill that is $20,000. It's going to take you 20 years to pay. So what? That's just how we want you to start looking. But that's not always the first thing that comes to person's mind, but that's what we're there for. And so when we encourage persons that yes, we understand that you're going to start thinking about the bill, we're saying to you, don't. Because down the road, if I've said to patients sometimes, so what, pay $20 a month for the next 100 years. I don't know,
Yeah.
you won't be here for the next 50 years, who cares? But we we know that maybe we would have gotten to you to the cath lab to fix your heart, and you could have some quality of life, you could enjoy something. And if you have to pay $50 a month, that's what you have, that's what you can afford. We don't want you to think about the money. So
Yeah.
truly they shouldn't first, but it is not unrealistic as people are facing the everyday challenges of their lives that becomes a big deterrent. But tonight we are encouraging those, anyone's listening, that we don't want you to think about the money first. Think about your health first, and then we can work out the bills later.
Okay. And while we're along that, what about if, say, in that instance, what about persons showing up multiple times, maybe for the same reason, cannot figure out what's going on? I went to the ER this evening, but 2 hours later, I feel the same way. Should I go back? Do I feel like I'm bothering them? I go back and I go back again. Is it something that you should do if you're not feeling well? You should go back to the emergency room?
Absolutely.
Yes, and yes. So what you're asking is it okay if, right? Like, but now I've gone 3 times in 3 days.
Yes.
So, but perhaps you're having an ongoing medical emergency.
Right.
So one of the things that we always say as we're discharging from the emergency room and we're going over instruction is, if you feel worse, if these symptoms come back and you're concerned, please come back to the emergency room.
Good.
Maybe you'll come back and we say, nope, everything's okay, but at least you've gotten that sign off. The
Yeah.
worst thing, the nightmare for any healthcare worker is the idea of somebody sitting at home thinking, this will probably go, or I don't want to bother them, and something terrible happening to them.
Okay. Sounds good. Trust and past experiences. Roughly 1/4 of men report feeling judged by a doctor in the past, which can lead to long-term distrust in the medical system. What could make me mistrust my doctor?
I can say the number one thing that we, well, I worked in Delaware for a while, and then I worked at Cape Cod Hospital. And one of the things that I will see consistently, somebody just has to get a diagnosis, misdiagnosis once, right? Or an error someplace, or too different, or a message that is not consistent. So you're getting mixed messages somewhere. It breaks trust. It breaks down trust when you don't think, or you don't, the message that you're receiving is not clear. It is not consistent. Or, like I said, the one that I know I see consistently across two big healthcare agencies that I have worked with is patients who says, oh no, those ones, they never give you the right diagnosis. I feel like I have to go someplace else. And that's one. I'm sure Jess's a lot of her experiences around the emergency room and how people view emergency room visits also. So maybe there's a different perspective on it. I spent a lot of time in the cardiac, in the CCU, where trust was a little bit, someone is, if you've done a good job for a patient and they have you for a couple of days, you're there under the consistent care of that same physician, trust can be established a little easier. Now in the emergency room, where providers change sometimes from day to day, shift to shift, you can see that it could wear down trust in that sense. I'm gonna bounce back a little bit on Jessica to see if she has something
Sure.
to add on
Thanks,
that.
Pam. I think that a doctor builds trust with their patient the same way a human builds trust with any other human, which includes listening to the individual and taking time and responding. Unfortunately, in our healthcare systems nationwide, doctors are really forced to rush. Maybe they have to be entering information into a computer and they're not able to look the patient in the eye. So there's a lot of ways where the system puts up obstacles, but there's also bad fits. I mean, there's the old joke. What do they call the person who graduates with the lowest score from medical school? They call that person doctor. So, it's not out of the realm of possibility that somebody encounters a doctor who is just not the right fit. They're the wrong personality. They're not listening. It can be harder on Nantucket, but even here, I would say two things. One is you can always opt for a different doctor, right? You can shop around to a certain extent. You may have to wait a long time, right? But, don't just settle, because you want to have a doctor that you do have a trust with. Also, doctors, this audience in particular, I think will understand quite well, are not God. And they're not the boss. So they have a lot of information and they are there to help and serve, as are all of the people in the medical world. But when going to a doctor, if your feeling is, okay, they're going to tell me to do stuff and I won't agree, but I'm going to have to do it. No, it can be a dialogue and conversation. You can also make your own choices, even if those choices are dangerous for you. But at least if you go to the physician, if you go to the doctor, you'll get the expert opinions. Then you're going to make your own choices. So I would say if you don't trust your doctor, get a different doctor. Don't just go the rest of your life without a doctor. That's a losing proposition. And if you and your doctor are not clicking well, feel free to let them know. And their response will help you determine if you should go to a different doctor or not.
All right, so hear this now, and this is from experience. I'm going to give you a scenario, and this is my personal experience. I went to get some prescription, my regular prescription from my pharmacy on Main Street. Took out got my prescription. Coming out, somebody saw me with the bag. Oh my God, what disease do you have right now? You're coming from the pharmacy. You know what I mean? Small community. I walk into the hospital. Before I get to registration, I have to say hi to the 10 people I know first. And this is me. Or by the time I get to my doctor, I would have said hello to the person registering me, 10 nurses that I pass, 2 heart doctors, you know what I mean? Small community, because this is Nantucket. Does that play a role in sometimes me not wanting to go to see the doctor because I know everybody? Or if I decide to go, I'm not going to Nantucket because everybody at that hospital knows me. Let me go to Cape Cod Hospital. I walk over to Cape Cod Hospital. By the time I get there, everybody knows me. Can some of these things too prevent me from wanting to go to see a doctor? Because if I walk in to do a test and maybe that result turns out to be something that I really wasn't expecting or don't like, who will hear about it? Do we have these kind of mistrust that cause people to that not wanting to show up for medical treatment or examination or stuff like that?
Yes. I I'm thinking about because let me just say this. There is value in being sometimes in small hospitals and knowing and in being in a smaller system than being in. So I want to preface what I'm going to say with that. There is a lot of value. Sometimes we miss that because on the other end of it, we're concerned. Yes, we're in a small community and you may feel like your privacy is not protected, or you feel like someone is going to get your business out there or your medical. And I will say this because I know that is a concern for lots of persons, especially I'll go back to culturally for us Black persons, Jamaicans, everyone wants, no one needs to know what I'm going through until, and you have that right. That is
Yes.
your right. We are, as as professional, as healthcare providers, we're bound by privacy laws. And I know that sometimes we've seen it. People say they're bound by, but your story still gets out there, and that is very unfortunate. It shouldn't be. It should not happen. There should be there's protection around you, that when we treat you, it is a confidential matter. So the message has to be, if that is what persons are encountering, then we all need to know that. But I really do, and that's just me personally, because I've worked in big systems where our patients get lost. And in small hospitals like Nantucket, I have seen the care and compassion over and over. When somebody knows you by name, I hear just saying someone taking the time to talk to you, to listen to you. You are not necessarily just a number when you are in a smaller system. So if you compare, someone just came back from Mass General Hospital the other day, and they told me that they were sharing a room with somebody else. And she says, I pretty much am using the bedside commode, and I'm leaning like into another bed like right next to me, and I felt like I was just like a kind of like a chart, a number.
Mhm.
Then when she came to Nantucket Hospital, it's a whole different experience. She says, so psychological, I felt there was some psychological safety here. Not only was there physical safety, there was psychological safety. There were faces that I knew. The smiles were pretty much the same smiles that I saw every day. So again, there is value in being in this. It is unfortunate and it is sad for us if we know that part of the reasons why people don't show up for care or show up for health care, especially in this system, is because they think that their information will be compromised. That is unfortunate. It should not be happening. And we do not want our patients to miss the experience of having a close connection with their provider because they feel that they cannot trust that their information would be protected. So
yeah, and there are really clear laws. We are, as Pam said, we're bound. The hospital is bound. I know that all the laws in the world don't keep people from being people. But there are really strong rules. And I would also say if somebody ever encounters a situation like that, they should bring it to the hospital to let them know, because as Pam said, the more they know, if that's really an issue, I think there would be a real effort to do re-education amongst staff as well as amongst the community, because that would be a shame if people weren't coming because of that.
Men develop heart disease 7 to 10 years earlier than women and have higher mortality rates for 13 of the 20 top causes of death, including cancer and COVID. Men's primary health risk heart disease. Men are more likely to have cardiovascular disease and experience heart attack at a younger age than women. Expound on that for me, please, and how do we go about preventing that?
Well, I mean, we've known for years that men tend to have ultimately a shorter life expectancy than women. And some of that is the cardioprotectives that women have in the process of giving birth, which can help protect them from heart attacks. I think we used to see 30, 40, 50 years ago, a lot more men in their 50s. I mean, as you tell us these statistics, certainly it's still an issue, but we saw a lot more men dropping dead in their 50s. And I think that had a lot to do with the expectation that you go out, you get a job, you support your family, you suck it up, and you don't ever see the doctor.
Right.
We had a higher meat and fat diet. There were a lot of things. So there are some things that have changed. My feeling is the biggest way to stop that cycle is preventative care. I think the more preventative care that, which means the care that you get before you're sick, essentially. And for people who don't want to go to the doctor, that's a hard sell. But what it can mean is a longer, healthier life. So preventative care, and also the preventative care that includes teaching our young men that this is an important part of being a man, is taking care of your health. Go ahead, Pam. I heard you talking.
No, I agree. I absolutely. The only thing I'm adding there, which you kind of touch on, again, why those statistics are that way, is because, again, men do not seek healthcare. Women we just go to the doctor more, I think, when it comes on to the suck it up or the grin and bear it. What we find is women are going to show up if their fingernail looks like they're going to want the answer for that. Like, what's going on with me? I have a headache. What's going on? If they have to keep going, they will. Men, on the other hand, will not. It takes a little. It's like just said, sometimes it's a hard sell to get to the doctor. So that's why we see those statistics. But as we are in this century and we are seeing there is more information out there. And I do believe that men are getting it. Families are having these discussions, and we are seeing more men who are presenting for care, and we're seeing some more. It could be better, and we want to put that out there. We want to make sure that the information continues to trickle down, and it gets where it needs to be filtered and get into the places that it needs to go. But I think that they are hearing, because they are seeing we have more RIPs for men than we had. It's lessened, but it is a lot more than it is for females. And heart diseases continues to be one of the number one, in the top 5 for early deaths in men.
Yes, this is very serious, because even this week, recently, I've had friends who have had young men passed away just like that. No car accident or falling off a tree or anything like that, but just die pretty much like that. Men die younger than women on an average. Lifestyle and behavior, men are more likely to engage in higher risk taking behavior, smoke, consume excessive alcohol, and have unhealthy diets. Specific condition, higher rates of what is this word? inguinal,
Hernia.
Hernias.
aortic
Aortic.
aneurysm,
Yeah.
gout, kidney stones, and certain cancer like lungs, liver, bladder. Women primary health risk is cardiovascular, and it says changes while protected by, as you were talking about estrogen earlier,
Mm-hmm.
women's heart disease risk rises significantly after menopause. So there is a gap there for these things because men engage, and most I would say most men, that some men engage in these kind of high risk behaviors, and as a result it lessens their lifetimes and they drop dead earlier than women, and that is not good. Why why is it that why is it that men have, let me see what the question, I have a question here. Yeah. So with all of this, like the hernia, yeah, I want that answer, and the aneurysm and the gout and the kidney stone. Can you tell us how those things come about?
Sure. Well, the inguinal hernias tend to be from doing heavy lifting,
Okay.
and not being protective about that. I
And
don't.
this could this be also because if you're lifting, you're supposed to have a certain balance and bend
And
your
use correct
knees.
body mechanics, and also use a lifting belt if you're lifting a very heavy. So I think men are more likely to say, I can handle this. I've got it.
Mm-hmm.
I've got it. Right. And so we see those hernias.
And the aortic aneurysm.
Aneurysms.
Mhm.
So, Pam, I don't know if this is accurate. I know that aortic aneurysms we see often with a high amount of belly fat.
It is. So, and I know that it is listed among them because when you talked about the meat and potatoes kind of diet, where that's where we kind of see I don't I'm trying not to put a stereotype around the look, but there is a certain kind of male population that we do see a little bit more rotund, where we see with aneurysms. Not that in aneurysms too, of course, we know can be what we call idiopathic, unknown, right?
Right.
We don't know where they come from, or someone. We also have aneurysms from someone has uncontrolled, unmanaged hypertension for years, that they eventually blow they'll have a brain aneurysm, something burst in their brain. So but yes, long short answer, it is going to be a lot of the lifestyle, the unhealthier lifestyles we see result in some of those things. A gout can be a little more tricky in terms of when we give that a male diagnosis versus a female. Sometimes I don't necessarily think that gout is based on lifestyle, like unhealthy lifestyle per se.
Yeah, there's a genetic component with gout. Once you
Yeah.
have gout, then you'll have more episodes based on some lifestyle choices with diet. But
Right.
yeah.
See, this is the reason why I have you people on. You are so knowledgeable and you are explaining in layman terms. So for those of you who are listening, I would suggest you listen keenly because we're talking to medical professionals who are in the field every day in the hospital, in the nursing homes, in medical field. These are people who see these things every day and understand it and have dealt with these episodes every day. And so they're explaining the causes for these things. And men more than women with this kind of high risk behavior are the ones who tend to have these more. So they were explaining gout. Explain kidney stones, please.
Well, they're intensely painful if you've ever
Yes.
had one. I will also tell you, kidney stones is not something you want to manage at home.
No.
And there is treatment in terms of for the pain that is very effective. It is not a narcotic.
Are you saying not drinking too much water to pee it out, something like that?
Yes, please don't do that.
Okay.
And the pain is pretty severe, so that it's rare the person who avoids the doctor for kidney stones. So these are literally stones, right? Little collections of grit. The grit can be made of different things. They can be very, very small. They can be larger. They develop in your kidney. They get caught at some point, anywhere from your kidney down through the tube that goes down that brings the urine to the bladder, all the way from the bladder and out of your body. They can get caught in those places. When they are moving around as they're caught, they cause intense pain and spasming. If you were to try to handle this at home, one of the things that could happen, especially drinking lots of water and thinking I'll pee it out, is maybe that stone is big enough that it's blocking that tube. And now you're going to get a backup. You're going to get fluid all back up into your kidney. Now you've got a serious issue when you could have dealt with something a little quicker and easier. That's my version. Go ahead, Pam.
No, that's the correct version how you explained it. I think one of the things as you were asking is, we're thinking as we educate you on wellness is what really causes kidney stones. Some people it's dehydration, high salt diet, high sodium, obesity. But what Jess explained, and sometimes you can't really miss the kidney stone because the pain is so intense. And like you said, if you stay at home, eventually you're going to end up going to the emergency room. And because she's an emergency room nurse, I'm sure she's seen kidney stones many a times. And the impact when you're trying to do it at home and then we end up with something bigger than you have that urine that's backed up that gives you infection. We see people become septic, go into septic shock from from a kidney stone. So getting in the hospital, and sometimes it requires a surgery. I just recently had an experience with someone very close to me who a flank pain or the back pain that they're feeling that is just so it's pretty much unmanageable, and had to be flown off so that they could see a urologist, because we don't have a urologist here in Nantucket. And so when it gets to that point, that was a Boston Med flight that had them going to see a urologist so that they could break up that stone for it to be removed.
And sometimes the stone, we're able to check and see if it's an emergency or not. So it doesn't mean just because you have a kidney stone, you're going to get a med flight. Sometimes
Right.
you come in, you're in intense pain. We're able to treat that. We're able to send you home with medicine that treats that. And we send you home with a little filter that you pee through in order to try to catch that stone. You're going to go ahead and pass it at home. But we've determined, okay, you're safe. We can give you some medicine that controls the pain, that helps the thing move along. And again, if it gets worse, yes, please do come back to the emergency room.
Good. Autoimmune and chronic disease. Women are more likely to suffer from arthritis, depression, and autoimmune disorder. What is autoimmune disorder?
So auto is the body, is something that the body itself, the simplest way we can describe it is the body attacking its own self. It's auto, and of course it's sometimes mostly genetic. Persons are born with some of these diseases. You can develop some of them, like lupus, especially in our population. Lupus is a common autoimmune disease that adults deal with in children and young people. But auto means your own system attacking itself.
Yeah, essentially your immune system goes in overdrive and acts inappropriately.
And it says osteoporosis, higher risk due to less bone tissue, because I've heard these advertisements all the time on TV talking about osteoporosis, which, generally more like women than men. Am I right here?
Correct.
Mm-hmm.
Okay.
And osteoporosis I think some people hear that and think, no big deal. So my bones are a little thinner. But what that means is without treatment, and as you get older, if you're not doing things to help support that, you're much more likely to break a bone, a very large bone, when you have a fall, which definitely would potentially equal a med flight, which we want to avoid.
So, Black men in the United States experience significantly worse health outcomes and lower life expectancy, approximately 71 to 74 years, compared to white men, approximately 78 years, driven by structural, socioeconomic, and environmental factors rather than biology. Black men face higher rates of hypertension, 40%, obesity, 38%, and premature heart disease, death, along with higher mortality from prostate cancer. Is that because sometimes, like in general, Black, and I would let me use Black people rather than men for a little bit, are more at a disadvantage at the healthcare system? Is that a factor?
That is absolutely a factor for sure. So we have a word in healthcare that we call health disparities, right? And health disparities we see across when we compare certain groups, say Black, Caucasian versus Caucasian, Asians and Caucasians, Latino or Hispanics and Caucasians. The disparity in that gap is so wide in terms of number one, access to care and the quality of treatment that they get. And and I'll jump to the men a little bit, but not only when we talk about that disparity stretches across all socioeconomic background in the Black community. So we're talking about Black women who are pregnant. So we see high risk of maternal death, maternal or fetal illnesses. We see even so that alone, just race and ethnicity is a disparity. So we hands down there is already a significant gap. Again, number one, for access. Where are they accessing? How do they have access to healthcare? And also, what quality of care are they receiving based on color, really,
Yeah.
and ethnicity? So, yes, number one reason, one of the main reason why there is such the mortality and the poorer outcomes for our race, for our Black men and women, is simply because of where they are and who they are. And that's just the truth.
Do you think we can come up with something that so what do we let me say it this way. Is it that we have to be our own advocates, or because, well, then again, they're going to be afraid to come in if they feel like they're about to, well, they probably have to feel like they're about to die before they come in. But I was thinking that, do I have to be the person to speak up,
Yes.
for that community, to say something has to change because this is what is happening to this particular community? Because right here it says, the rate is 1,070 per 100,000 than white men, which is 881.3 per 100,000 men. Like, who speaks for us? Do we have to figure out a way of coming up to speak for ourselves, or we're going to have somebody speak for us to say, this is how it is? It's quite unbalanced, because I think if you check the statistics, they are probably the same 10, 15, 20, 50 years ago, and it continues to this day, even in modern world. Why?
Jess, I'm going to let you go because I feel like I.
Sure. Yeah. I mean, I think part of this has to do with representation.
Yeah.
And, unfortunately, there was a time when unfortunately, we still are in a time when most of the doctors that we encountered were white men. And now in medical systems, you see people from all over the world. But we still don't have enough Black men and women who are medical providers. We certainly don't have enough Jamaican men and women in the United States who are medical providers. And I think that if you don't see yourself represented in the people caring for you, that can be difficult for you in getting the appropriate care. We also have so much bias from the people providing the care. And some of that is bias that people are aware of, thinking, oh, I'm not going to, and that bias can be against somebody because of their color. We see that bias when it comes to older adults, which is the population I mostly work with now, where doctors say, well, what do you want? You're old, instead of actually investigating issues. But then we have the world of unconscious bias, which is all the ways in which these medical providers are making decisions, making personal judgments without even being aware of it, based on the individual's race or culture or class or gender. So I think that's why it's happening. I don't know how we get through it, but to answer your original question, yes, you do have to be the advocate. Each and every one of us do. This is why I think it's so important to remember the doctor is not the boss or God or anything like that. They're an educated person to give an expert opinion, and it's still your life. So the more we speak up and ask questions, heck, you can ask your doctor, have you heard about unconscious bias? What is it that you do to work against that, to make sure that it's more fair?
Sounds good. All right. Chronic disease. Black men are more likely to have untreated hypertension, suffer from diabetes, and stroke, often at younger ages. I'm diabetic myself, so I can relate to that on my medication. Prostate cancer. African American men are 2.5 times more likely to die from prostate cancer than white men. The higher the higher incident rates, earlier age of diagnosis. Mental and physical health. Black men face greater societal stresses, including racism, economic disparities, which contributes to higher rate of chronic illness you just spoke about. And we have to be our own advocate, because if we don't, then it's just going to be the same today, tomorrow, and next week, Friday. Institutional mistrust and experiences with discrimination in healthcare settings can reduce access to quality care. And we talk about that, and we see. And I myself, I'm an advocate for my mother, as many of you may know. And, seeing where I have to speak up, and I have to be firm, and I have to be flat-footed in asking, because if you don't, then it is just or because of, you know what I mean? So how can we, when is this going to happen? Does this have anything to do with our elected representatives? Does this have anything to do with somebody we know? What can we do? What can we do to make these changes? I know hopefully this platform is helping to educate people, so people are watching could be more self-aware, or if you feel like you need to see a doctor, then you should, because seeing a doctor does not tell the world that that's what you're doing. You can quietly go see your primary care doctor and get your treatment, and the world doesn't have to know this. You know what I mean?
And you know what? In a way, there are some things that are definitely protected, because I hear you make reference to that a lot. But here is a good example that is being said. You going to your doctor sets an example. I don't mind somebody seeing you going to be getting a checkup. So there has to be what I see, I do. You see somebody else doing, and somebody else setting the example. and leading the charge on saying that this is important in our community, that we maintain our health. When you see somebody else walking, exercising, becoming a part of building groups so what that they're maintaining health, just that example alone is very important in your community. Sometimes it's not a good thing to hide that we're going to the doctor. Actually, what they don't need to know is what you're going for. But
Yeah.
seeing people maintaining health and making it a priority in their lives really sets the example for someone else to follow. In a healthy community is a good community. So if
Yes.
everybody's out there on the bike path walking and you see somebody else walking, it shouldn't be anything that, oh, because I am a little overweight, that's why she's walking. It doesn't matter. That's a very good thing, actually. So that's a good example to set. And I hear you in terms of self advocacy is always going to be good. So, and we amplify each other's voices when we go out there and we speak up, then somebody else could come along and speak up. And when we talk about representation, encouraging other persons to get involved, especially we have health fairs that are going on. It's not very often that I see our people at a health fair. They do not go for the information. It's out there, but they're not taking the time to do it. And I don't know, but I think that they're going to be some of us who are just going to have to lead the charge. And so we set the example, set the tone, and maybe others will follow. So here we are. You are doing a good thing. So you host a platform such as this, and you have these kinds of conversations, these discussions that we're having that puts the information out there that maintaining your health is important. Lifestyle management is important. Mental health is important. Rest is important. Sleep is a priority. Good nutrition, exercise, getting your checkup, keeping schedules for a mammogram. Exams are important. It is just that we're going to, and men who are saying, I got my prostate checked is a good thing.
Yes. Yeah.
And as you're on that, do you think that the church can play an important role? Because I watch some churches from Jamaica now, and what they're doing, they're having health seminars, asking people to go get your blood pressure checked. Because people are hollering for Jesus every day. And what they think is that, okay, I'm hollering for Jesus, so my blood pressure is not high and I don't need to go to the doctor because once I say Jesus. But where is that line where you say, I am a Christian, but I believe, because I have to say to medical professionals, I am a Christian, but I believe in science and medicine. Do you think the church should host seminars and encouragement to say to members, men and women, you really need to go to see the doctor?
Oh, how I've wanted to answer this question so badly because there is no going around more than a big yes. That is just you can just blow that up and put it wherever. As a matter of fact, I think there is a responsibility within the church. You know how there is faith and medicine, there is a place they can go hand in hand. There is, you don't need to separate them. They go hand in hand, just as the church is praying for the sister when she is sick, you're having cancer, and so everyone surrounds you and start praying for you. There can be or should be, way before we even get to that, did you have a mammogram? They can have that very same schedule. October is Women Wellness and Awareness Month. Get your mammograms done. I do believe that the church has a role in helping their congregants and their members to live a healthy lifestyle in terms of physical and mental health. And one thing I will say is medicine has its place, and I know this. Medicine has to be humble about the fact that clinicians don't have unlimited understanding. There are many things that they do not know. There are many things that's why there's still research happening. They're always looking that there are some things that we don't know the answers to yet. But one thing we do know for sure, I'm a Christian and I will say this, the only person that I know with an unlimited understanding is God Himself. So if we're saying and we're acknowledging that we have limited understanding and there is somebody else out there with unlimited understanding, there has to be a way to marry both. There has to be a way to tap into both. Us with our limited understanding, we have to trust our faith is going to have a role in it, but we're going to have whatever it is that we learn, we have a responsibility to give it to the people within the limits that we know. And then the rest of it and all of it, we combine it and say God is in it, but there is a role that we have to what we know. We give to we give to the people and say, this is the limits of what I know, so I'm going to give you what I have, and we know where they go for the rest.
Yeah, because I think, the church is church is like half of our lives these days, and I think it should be an open place that encourage us to be good people, to save our money when we work, encourage us to take care of our health, because this is how you're going to show up at church on Sunday morning and you don't hear that Sister Mary had a stroke and have to be in the hospital. Or, everything, help you to raise your kids, encourage you, teaches you all these things. And honestly speaking, I think the churches today, and this is in general, and this is under a broad, big old broad umbrella, that the churches, most of them are not taking the time out to say to people or to have seminars or little gatherings in checking or making sure that people are doing these wellness, health and wellness check. Say, you have a little seminar. We're going to have a little seminar. Now we have Pam, who is a person with great knowledge, to say, we're going to have a meeting on Wednesday night, and we want her to come and speak to us about how we should go about getting these things done. Yes, we do have prayer meetings, and prayer meetings are good. And I remember one time a church sister sent to say she has a headache and she needs prayer. And although the prayer was good, I said, tell her you can have 2 painkillers. You can take 2 painkillers for a headache. We'll pray for you too, but you can take 2 pills. So it's not, it's not like you are. I believe in the power of prayer, and I'm living these things every day as we speak. Yeah. So there's a balance. And as I clearly say to a doctor, I said, we are people of God, but we believe in science and medicine. And I think the church really needs to step up in its role in encouraging people to seek better health. Black men are also faster in declines in cognitive health. The stigma around Caribbean men and healthcare is a complex issue rooted in cultural identity, historical mistrust, and societal expectation for masculinity. Many Caribbean men avoid the delay seeing doctors often, only seeking help during a medical crisis. We talked about that. Stigma of masculinity and socialism, traditional gender norms often equate being real men with strength and independence and the ability to endure pain without complaining. Seeking medical care can be perceived as a sign of weakness and vulnerability and downgrades one's status. And as we talk about that, we have to talk about our people. We have to talk about blacks, because we are black. There's no getting around that. We are black people, and then we are Jamaicans, and then we have. Let me read a little bit more. Specific medical exam, particularly to digital rectal examination. And this is a big one. And I'm sure you ladies are like sitting on the first seat, the second seat, and the last seat in experiencing all these kind of stigma that surrounds the DRE for prostate health. Elaborate on that for me, please.
Sure. So the digital rectal exam is the prostate health exam in which the doctor takes a finger, a digit, and puts very small amount of it into the behind, into the anus, in order to feel for a prostate that is enlarged. there are a lot of feelings that men, particularly Black men, I'd argue probably Caribbean men, feel about anything that might imply that they would allow something put into their behind. And so it becomes an issue for many men, but I think in particular, and so they avoid it. And meanwhile, prostate cancer has historically been one of the most treatable cancers. It's very unusual. It's President Biden is a real outlier, actually, that a prostate cancer can become serious to the point unless it isn't detected and treated. I think that men think, well, if I do have this cancer, not only will I now have this digital rectal exam, the DRE, which I'm terrified of, but now I'm inviting all kinds of other things to happen there. And that is not, in fact, the case at all. Medical care can be uncomfortable, but it's quick, it's professional, and this exam, I mean, I've seen big, strong men put up with much more uncomfortable situations, but that's a real shame because it can end your life, right? To have a prostate cancer if it's not treated. And I think there's such a fear. There's a lack of knowledge. I think if we could have videos, cartoons that really show you what this process is, I think people in their minds can imagine all kinds of terrible things. And it really is quite a small introduction of a finger. Sorry.
Atifa, anything to add to it?
Or to add to it then, exactly. And you kind of shed light on it, especially Caribbean men who are the level of homophobia just really, they cross that line, and it has nothing to do with that. It's such a simple exam and such an important life-saving, if only it's so quick.
It's so quick.
And there's a ton of information that can be gathered from it. So again, this is where I am imploring the example is set where men are saying that we have some champions, we have some stewards that stands up in our community. And
where's a pin? I had my prostate exam today.
Yes. So when we're talking about voices and how we advocate, who stands up, sometimes it is the men that you need, those courageous men who will say, I have done it. It is not, and there should be no shame to it. And, people feel like they're not as macho and, you've taken something away from them because they have allowed, especially if it's a male urologist, that even just really tops it off. Like now they really are not going. But I think the conversation needs to change.
Dying of cancer is much more emasculating than
I
would
think so too.
Yes.
Cultural views sometimes associate these exams with homosexuality,
absolutely,
leading to extreme reluctance in undergoing screening due to local homophobia and the fear of losing one's masculine identity, which is crazy. I mean, if your thought of losing your masculinity or losing your life, you can measure that. Right? Okay.
Right.
Mental health taboos. Struggles are often dismissed as lack of discipline or spiritual weakness. Men may fear that acknowledging mental health issue will bring shame to their family and lead to being labeled by community. And some of these, like, how men don't cry because you're a man, you should not. Well, let me tell you, with my mother's situation, I bawled like I was badly beaten every day. That I can tell you. And I didn't care about anyone because it's what I'm feeling. And this is how I'm expressing myself. And I would prefer, because that helps me, in soothing my sorrows by expressing myself that way. So, and I didn't think any less of myself because there was great need for it. And culturally, and I'm Jamaican, Cultural expectation for men to be providers often place on their own health at the bottom of the priority list. Busy work schedule and high cost of care can further determine from preventative checkups. What we are doing right now is we're imploring people in general to get checked. Men more than anything else, because they are the stubborn ones who hate getting checked up for medical protection, for preventing a cancer from going too far, or from a heart disease or a heart attack or a stroke. I am sure as we speak, we know many people who are in the system who are laid up right now.
This is a reminder.
People who, sorry about that, folks, people who are laid up in hospitals, who are in nursing homes, who are at their own homes because of 1, 2, 3, or 4 of these reasons. Here is something now, and this is just a little in close to wrap up. And I want to say I thank you, ladies. I tell you, tonight I feel really good having you on because, as I said, you are knowledgeable and know more about this than anybody else, because this is something that you see every day in the medical field because you have been working it and you have decades of experience. Reluctance among Jamaican men to visit a doctor is a well-documented challenge, often rooted in the cultural ideals of masculinity, the fear of discovery, and the preference for reliance. Statistics shows that approximately 67.7% of older Jamaicans men had not visited healthcare provider in the year prior to the major 2011 survey. 67.7%. As far as some women could have dead husband walking with them, dead husband sleeping in their beds, husband with heart attack, husband with stage 4 cancer, husband with strokes, and they don't know it. 67.7 has not visited healthcare for any reason. Seriously, how do we correct this?
One individual at a time.
Mhm.
I think it has to be normalized.
Yes.
And I think Pam made the greatest point, which is that it's about, there's a lot of efforts that can be made. I don't mean to make it sound so simple, but all the efforts and campaigns in the world aren't going to match what Pam said, which is people in your community standing up and being examples and saying, I'm gonna make sure. I think that it is definitely true that if churches would participate more in having health discussions and that kind of thing, I think that'll help too. But I think what really will make the difference is when somebody, if you're somebody who is not going to go to the doctor, but your best friend or your cousin or your brother or whoever it is says, no, you know what, I really want to start doing preventative care and I'm worth it. And I want to live a long and healthy life and I'm going to start doing this. That's what makes the difference.
Sounds good. Now we're going down into we're going to go down into something different now. Now, I don't know, and this is something that I have spoken about and spoken to medical professionals while I was going through 3 years of dealing with people from Mass General, starting out from Nantucket Cottage Hospital to Mass General, to Spalding's, and then to a nursing home. And here it is. Divine intervention, and it has to do with healing. And when we think about medicine, doctors, and God, what role, who plays in what? And excuse me, I said to medical professionals, I don't know what your Christian background is, if you believe in God or not, but I am going to tell you right now that I am 100% a believer in God Almighty, Jesus Christ. So let's not get any ideas. I am going to make this plain to you. In making a decision with my mother's care and the report that we had gotten at the time when she was in Mass General and the decisions that we had to make, we had to do this based on our faith. Now, I want to ask, I know Pam is a Christian person, and I know Jessica also believe in God. What part of religion, what part of faith do you believe in as it results in even illnesses and dealing with them? And are there any point or any time in the medical field where you could say, I really have to put medicine aside, but this is a miracle? I want go right ahead, dive right in.
Well, I've
Well,
certainly seen miracles.
mhm.
I don't think there's ever a time where I say, "Oh, I'm going to set medicine aside," because as Pam said earlier, I think they go hand in hand. They can be hand in hand. But you said something earlier, Chad, about somebody has a heart attack and a doctor comes into the room, does his thing. Now the person is better, and I thought, oh well, that's interesting, because yes. I've been in a room and someone has a heart attack and the doctor and the team comes in and we do our thing and the person lives. And I've been in the room where the exact same thing happens and the person doesn't live. And certainly there are different circumstances, but I would argue that there's medicine. There are the efforts of man, as you said, right? And working to save this life. And that's all the knowledge, etc. But then there is that person's soul, right? Sort of separate from their physical body. And those two are together at that moment while they're having that heart attack. And so I would say that's probably what makes the difference, is that soul. And who ministers to that soul, to God, is what makes the difference on whether a person lives or dies. Now, God could be in the room, and if there's a heart attack, but nobody comes in to do the CPR, or somebody comes, the doctor, and we say, no, we're going to let God save them. I think it's a lot harder for that person to make it. But yes, I think that medical science is also an inexact science. Pam said it before. We don't know everything. We're still researching. There's definitely room for miracles. They happen all the time. Doctors will say you have no chance of life and someone lives. But in general, that doesn't happen by them walking away from all medicine, right? They still engage in the treatment, and then they're able to live because of something beyond just the medicine and their engagement in it. That's my thought.
Okay, Pam, you're back. Welcome back.
Yes, I think so. It's a quick answer for me that, of course, like Jess, definitely miracles have to happen. But I've seen many a times I've said it had to be God that stepped into this situation for it to have turned out the way it turned out. We've seen so many. There is personal experience I've had with someone who have what we call the blockage of a left ascending artery, which they call the widowmaker, right? Say when that artery is blocked, that person is, you're making a widow, is the person who's left behind. It's almost guaranteed they're going to be a widow. And so I remembered, there was someone who had that artery was like about 99% occluded and barely made it to the cath lab, arrested maybe 3 or 4 times before in the cath lab, in the OR. So many things were stacked up against, and I really, even the doctors, the cardiologist said, this is not going to be, I don't see any way out of this other than, and if there is even a way out of this, you're looking at someone who will lose some brain function, because of course there would have been no perfusion to the brain. Yet we see this person walks out of the surgical ICU, out of a a stent and everything else, that every odd was against them. And they were out, didn't even have to go to rehab or something like that. For me, I can credit no other, nothing else comes to my mind, that just was just pure God. That was just God himself. He had to have stepped in and clearly did that part. But of course, we also know, I've said it before, that there will always be a place for both to happen simultaneously and subsist. Now, where I think I struggle a lot, because there are persons who are going to there are those who don't believe in God at all, and so they will not credit any of their any of their interventions or their outcomes to God being in it. They're going to give credit to, it was the doctor who saved me, it was this who saved me. But somewhere there is not just physical healing that happens when someone gets, there's spiritual. There is a, if your spiritual state is okay, if your mind, the mental piece of it, and doctors really and truly, they don't work necessarily when they're fixing your heart. They're not necessarily speaking to your mental state at the same time, because you're under. I think there is a spirit that is guiding that part of you, that you stay sane, that you stay well. And so I believe, again, they go hand in hand. And for me personally, of course, because I'm a Christian, I do raise the bar a little bit higher, where I'm going to give God credit more than I'm going to give men credit, when it comes on to anything that happens in medicine, from where I stand. And so the short answer is yes. We believe in medicine, but we believe in miracles too. And um, yeah, I guess that's
That's
what
a
I'll
good
say.
thing. I mean, I'm sure I'm no stranger to any of you as it relates to medicine and miracle, because I witnessed my mother died for 5 minutes in an ER settings. The doctor worked according to God's lead, and it was a miracle. And my mother today is still a miracle. And I've put out information about that, and everybody who knows about my situation can attest to that she is a miracle. And I have expressed all of this to even the doctors at Mass General when I was there, because I remember when my mother was in that coma, and they gathered us and let us know that the prognosis was not good, and this shouldn't be happening and that shouldn't be happening. And, I respectfully told the doctors that, with all due respect, I know they have to give bad news and not every family member can handle these situations. But I thanked them for what they did. But I told them that I was not going to take their report for it, because there were two reports in front of us as a family that day: God's report and their report. They did what they were supposed to do. They did according to what they were taught. They did to the limitation or the limits to which they could go. But I and my family, we truly believed in God and the power of God, because prior to that, on the night when this incident happened in Nantucket, it was far worse than what they had in Boston to deal with. And it was God Almighty. So I said to them, well, I believe in God and God is going to take care. I remember the neurologist walked over to my mom, and when she starts calling her name and she looked down, she looked up at me and she gave me the pity look. And that look I read to say, see what I told you? And all I did, I stooped down to her and I said, doctor, don't worry about it. She'll be fine. Exactly what I said. And I looked up and I pointed to the heavens, and she looked up and said, yes, that's where our blessing comes from. But I think too that she thought that I was walking on Mars or I was out there in land. But the reason why I could do this is because I know the God I serve. And I remember I said to them, when the doctors looked and said, what can we do now? Should we continue with medicine? And I said, yes. I said, we are people of faith, but we believe in science and medicine. I said, we're not religious nut jobs who don't believe that medicine work. We do believe medicine work. And let me tell you something, that medicine that my mother was taking, God provides it. The doctor that was overseeing her, God provides him and works through him. The nurses, the same. And this is how I perceive these things. No doctor, no nurse, no healthcare provider, none of these people can do anything other than what God allows them to do. So the miracle is going to come through them. And this is the reason why, we don't separate doctors from medicine, because as you say, they work hand in hand. But I just wanted to know, like, I don't care if the doctor, my mother was dead and the doctor brought her back to life. It is God who did it. That's how I see it. So the doctors are good. Not saying that the doctors weren't good. There's a doctor in Nantucket. That night with my mother's incident, I can tell you, I witnessed all of this. And I cannot thank him enough, because I was there and that doctor worked overtime. The doctor in Nantucket that night worked overtime. And it was because of God who was working through him. And my mother is here today, which you all can see is a divine miracle. So I cannot separate. But we talk about this, and I have spoken to many medical professionals, and they say to me, yes, we are medical professionals, but there are times when we have to take 2 steps backwards and come to the conclusion and says, this is nothing less than a miracle.
Absolutely. For true, because that's what we say. What we know is that humans have limited understanding. We don't know everything. We can't solve every equation. Medicine cannot. And that's why when I said earlier, they're still searching for answers to many things.
Mm-hmm.
There would be no reason for research if they knew. They don't. They're still looking. There's always something coming up that they don't know the answer for, because again, we are human beings and our knowledge can only go so far. So there is a time when truly they do have to hand it over and said, you know what, this had nothing to do with, because I didn't have the knowledge. I didn't even know anything. I didn't know that this could be. I wanted to mention tonight, as we're talking about this, as we talk about, we don't dismiss people's faith or their spiritual belief or spiritual experiences when it comes onto medicine. I think a lot about the Jehovah's Witnesses, right? Who will say to you that under no circumstances will we take blood, right?
Mm-hmm.
It is part of their religious belief. Whatever their religious belief is, that is their faith. They stand on that, and they
Mm-hmm.
will tell you, but we have plenty Jehovah's Witnesses who really didn't get blood and they leave the hospital. They go home just the same, standing on the premise that they are not going against their belief that, uh, our belief or God, however we believe, whatever we believe our faith to be, we're not going to take blood or blood products. And they go out of the hospital, they go home. We've seen them, we've given them discharge paperwork.
Yeah.
And they go home.
Yeah.
So there is something to be said about people's faith and what they believe, the spiritual experiences they have, and how they approach their illnesses, how they approach medicine, how they approach treatment. And there is that we cannot dismiss
And I
or
guess they want
discount
to
that in
live
any way,
too,
shape, or
right?
form.
I guess they want to live also.
Yes, but they live.
I mean, I live to tell the
We see
tale.
them living.
Yep.
They've come in and refused the blood transfusion, and they live.
Yeah.
Medicine and science would say we look at a certain number and say at that
Oh, you
number
have to.
this is not conducive to life. You're not going to make it if you don't get that transfusion. But they say no, based on my faith, based on my spiritual beliefs, I am not. And I am telling you, we have given them discharge paperwork. They go home. They're not in the morgue.
Yeah.
Now that you said that, Pam, so tell me, because I don't know how it works, and I hope this is not dabbling into privacy or anything like that, but I think this is general could probably be a general question. If it's not, then you don't have to answer it. What if a person in, say, for instance, like somebody who's a Jehovah's Witness comes in and this person is dying and really need blood transfusion? And are you going to do it or refuse them because it's a part of their belief not to take it?
Hold on. So let me make sure I understand. You're saying that so they're a Jehovah's Witness
Mhm.
and they come in, and I'm just going to create a scenario, bad accident, and they bled out
Yes.
and they need blood.
Mhm.
And are you saying that would we just give them the blood because they're
Yeah.
dying?
Mhm.
No,
Okay.
no. We are ethically bound to present the evidence that says we're not going to tell, we're going to tell you that a unit of blood or 2 units of blood could make a difference for you. So we have to present you with what the treatment options are, even though we know that maybe, with what our knowledge and our teachings, we know that Jehovah's Witnesses, they refuse blood in that moment, every time, every opportunity, because maybe in that last minute you may decide you want it. We're going to present you the option and say, this is what you, and then they refuse. We can't just give it to you now because you, even if you're 2.0 and you're going to die, we can't just take a bag of unit and put in. No, we can't. So we
Okay.
need consent, and if that person is incapacitated to the point that they cannot give consent, then their next of kin or their healthcare proxies, which is another thing that I think we ought to be talking about. I mean, it's not tonight. Healthcare proxies,
Yes,
Yeah.
we should
would
be
we
talking about that. Yeah.
step in and they give the consent or not. And if there is no consent to give that blood, they don't get that blood.
And they could wake up dead the next morning.
Well, they're not going to wake up if they're dead, but they could be dead. But that would be
Okay.
their choice. And so they
Yes.
Yeah.
do have a
We
right to choose.
we will have to continue with this. So let's create a medical corner where we have, because I'm so excited to have you ladies on, and you have been perfect. Let me tell you, you have, and I'm sure I'm going to hear this because when I walk around and people tell me that they watch the show, they'll say, they, listen to some of the things. So you have been tremendous. So you now have a job with me, to come on and we have taken advice. I hope that everybody who's watching and who will rewatch this will take something to know that we need to take better care of our bodies and we need to get checkup. We need to go see the doctor, not only when we have a medical emergency, because sometimes that is too late. And this is going to be an ongoing where we can have people like you granting absolutely free advice to people who refuse to see the doctor. One should seek medical attention immediately for severe or life-threatening symptoms, while less critical issue may warrant an appointment with a primary care physician or a visit to an urgent care. Immediate emergency care, call 911 or visit the ER. According to Johns Hopkins Medicine, you should seek emergency medical care for difficulty breathing, sudden shortness of breath, choking, or lip or fingertips turning blue, chest pains, intense pressure, or pain in the chest, arm, or jaw, which can indicate a heart attack. Neurological changes, sudden confusion, slur speech, or weakness, numbness on one side of the body, potential signs of stroke. Severe trauma, head or spine injuries, deep wounds that won't stop bleeding, or broken bones visible through the skin, or loss of consciousness, fainting, or any unexplained mental crisis, suicidal thoughts or feeling of harming others, sometimes yourself, poisoning or overdose, ingestion of poisonous substance, or drug or alcohol overdose. Same day urgent care experts from Met Urgent Care recommend same day attention for high fevers above, I think, 100 and something, adults, or persistent fevers that does not improve with medication, persistent vomiting, diarrhea if you cannot keep fluids down for more than 24 hours, leading to potential dehydration, worsening infections, increasing redness, swelling, or discharge from a wound, minor injuries, sprains, minor burns, or cuts that require stitches, but not life-threatening, routine or non-emergency cases. What's this? Pardon me. You should schedule regular appointments with your primary care for persistent symptoms that last more than a week without improvement, unexplained changes in sudden weight loss, changes in bowel habits, or persistent low-grade fevers, management of chronic condition, regular checkups for ongoing health issues like asthma and diabetes. And that concludes this evening's show. We have to continue with more medical talking, and we'll definitely have these two lovely ladies, Pam James Blois and Jessica Tremble. Anything that you want to close us out with? And thank you for being with us this evening. Go ahead.
I just want to say thank you for having me. This was really wonderful. I appreciate the opportunity.
And I likewise will second that. Thank you so much. And Jessica, thank you for being alongside me here. And if anything I could say to your audience, it is health is wealth. And I'll continue to say that a healthy community is a great community. So check on your health, make it a priority. There is so many facets to health, your physical health, your mental health, your spiritual health. All of it matters. And we are here. We're in this community, and we will do our best to support you. And whatever questions you have that we didn't answer, we hope that we'll be able to come back again. But thank you so much for tonight. And Ochin, thank you very much for having us. Have a good night.
Thank you very much. For those of you watching on TikTok, we appreciate you. Those of you who are on YouTube and Facebook, we appreciate you. Thank you very much for watching. And don't go. I'm going to have to play my new song so that you can hear it. So stay right here. It's 2.5 minutes. Here it is.
I'm not hearing it.
You're not hearing it?
No.
I'm hearing it.
That's the right there.
I'm going to have to send you a personal copy, Pam.
Okay.
All right, ladies and gentlemen, have a good night and see you next week, Wednesday, for another episode. Good night.
Good night.